Welcome to the third part of our discussion on special stains, which will involve the stains for connective tissues, the pathologic changes found in connective tissues, and for muscles and bones. Connective tissues are made up of various cell components and it constitutes a non-living framework within various organs. The fibroblast is the amorphous intercellular substance that binds fibers together. It is also the one responsible for the formation of collagen. There are three different types of connective tissue fibers. We have reticulin or reticulum fibers, collagen, and elastic fibers. Reticulin fibers are a fibrillary extracellular matrix found throughout the tissues. They are made up of delicate, branching fibers that are not visible in the routine H&E staining method. These fibers are known to be silver-loving or argyrophilic and are therefore best stained with the silver impregnation technique. Collagen forms a much more coarser extracellular framework than reticulin. It stains selectively with acid aniline dyes, the most common of which is the picric acid. In acid-treated fresh preparation, collagen has a swollen, glassy appearance. Lastly are the elastic fibers that are made up of fine, intertwining, wavy filaments. They have a refractile appearance in acid-treated fresh preparations. They have a property of being isotropic and is resistant to most enzymes. In UV light, collagen gives a yellowish fluorescence, but if unstained, it gives off a blue color. Let us now proceed to the different stains used for connective tissues. For reticulin fibers, the stain to be used is the Gomori silver impregnation stain. It stains the reticulin fibers black, and in the use of this method, dust must be avoided because dust can cause deterioration and precipitation of silver solutions. Next are the stains for collagen. The Van Gieson stain, which is the simplest method of differential staining for collagen, and the Mason's trichrome stain. The Mallory's aniline blue is a stain for collagen, reticulin, and hyaline, so it is not differential and specific for collagen. Next is the azocarmine stain, which is used for amyloid and mucus colloid. Next are the stains for elastic fibers, which are the Weigert stain, Verhoef's method, and the Orsain or Tenzer-Una method. The Orsain or Tenzer-Una method is especially used for the fibers in the skin, so it is highly recommended for dermatological studies. The last of the connective tissue stains is the Krajian's technique, which is used for elastic fibers as well as fibrin and amyloid. Let us now go to the different pathologic changes and deposits found in connective tissues, which are fibrin, fibrinoid, hyaline, and amyloid. Fibrin is an insoluble fibrillar protein resulting from polymerization or enzymatic coagulation of plasma globulin and fibrinogen. It is commonly seen after tissue damage, in blood clots, or in acute inflammatory reactions. While fibrinoid is an eosinophilic material and its staining reactions are identical with that of fibrin, but it occurs in tissues under different conditions and disorders. It is found in collagen diseases, hypersensitivity, systemic lupus erythematosus or SLE, and rheumatic heart diseases. Hyaline are pathologic exudates and deposits appearing as smooth, homogeneous eosinophilic material. It is seen in degenerated collagen, hypertension, atheroma, and diabetic kidney. It is also non-specifically demonstrated using the PASS technique. And lastly is the amyloid, which is a semi-translucent ground glass or hyaline eosinophilic substance deposited in connective tissue cells, kidney, spleen, adrenals, lymph nodes, and the pancreas. This is commonly seen in chronic suppurative and inflammatory conditions like tuberculosis, leprosy, and osteomyelitis. The following are the stains for these pathologic changes and deposits. The MSB technique, or the Marsh's scarlet blue technique, and the Mallory's phosphotungstic acid hematoxylin, or PTAH. These are stains used for the demonstration of fibrin. MSB is so named because it employs Marsh's yellow, brilliant crystal scarlet, and soluble blue. Next are the stains for amyloid, which are Gram's iodine, Congo red, methyl violet crystal violet, and induced fluorescent staining with thioflavin T. Gram's iodine is considered the oldest staining method for identifying amyloid deposits. Congo red, on the other hand, is the method of choice. To be more specific, alkaline Congo red is the method of choice for amyloid determination. Methyl violet crystal violet is a metachromatic staining method and is not recommended for staining of amyloid. And the induced fluorescent staining with thioflavin T is used as a screening method and microscopic differentiation is not needed. We now proceed to the muscles, which provide power and movement to the body due to contractile properties, and bones, having two types. This slide is a review of the three basic types of muscle tissue, including their movement classification and presence of striations. We have the skeletal, smooth, and cardiac muscles. This slide is also a review of the two types of bone tissue, the compact or cortical bone and the trabecular or cancellous or spongy bone, including their descriptions and most common locations. Let us now go to the different stains for our muscles and bones. The stains used for muscle fibers are the following: modified Gomori's trichrome stain, Mallory's phosphotungstic acid hematoxylin, Heidenhain's iron hematoxylin, and Lissamin fast red tartrazine method. Next is the Masson's trichrome stain, which is a standard, popular method for staining collagen in bone. The Schmorl's picrothioneine method is a stain for bone, employing colors to the bone matrix, lacunae, and canaliculi. And lastly is the aniline blue or light green, which is used for staining osteoid. That ends our discussion for part 3 of the special stains.